The string of bad injuries this postseason continued tonight with Giannis suffering a pretty bad-looking knee hyperextension on this play. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. Let's dive right into the play where this happened. You guys know what to do if you want to help support this channel. So as Giannis is going up here to try to stop this shot, we can see as he comes down, pay close attention there to that left knee. Now, in this angle, we can catch a little bit of that knee hyperextension, but it's tough to appreciate the true degrees or the true severity of hyperextension from just this angle. But if you look back at this one more time in slow motion here, we can see as he comes down, that left knee right there, hyperextending, moving backwards. From this side angle, though, we can really appreciate the severity of the hyperextension. So again, as Giannis comes down, keep an eye on that left leg as he lands on a pretty straight leg. There's a couple of factors we'll talk about that led to this injury, but you can see just how severe that amount of hyperextension is. As the Hawks player is coming down, you can see first his right leg hits Giannis's leg. And what that does is it causes that leg to basically lock in extension as he lands. That's the first thing that goes wrong here, because typically you land on a little bit of a flexed or bent knee to absorb that load and properly settle down into flexion. But here, when the Hawks player hits his tibia, knocks it forward, locks that knee in extension so that when Giannis lands, there's no ability to absorb that load. And so then as he comes down further, there's even more force that's directed kind of posterior on the tibia, putting it into even more significant hyperextension. So when we're talking about the severity of hyperextension, if we draw a line straight down through the femur, that's theoretically where regular full extension is at of that lower leg. And so anything that's further past this way is going to be hyper or overextension. When the leg comes back up this way, that's going to be knee flexion. And so when it comes forward like this, that's knee extension. I'll be honest, this is a very significant amount of hyperextension. And it's also significant because it's forced hyperextension because of the Hawks player here coming down on his leg, forcing it with an external load into additional hyperextension. Sometimes we see these injuries occur like Bogdanovich when he was just running and sort of tripped over his legs and had a hyperextension without an external force. But here, there's that external force on the leg. And so that causes there to be even additional strain on the tissues beyond just what the body is going to naturally fall into. So one way to classify severity here is just the degrees of hyperextension. This looks to be about 30, 45 degrees, which is honestly a very, very significant amount. So just visually looking at it, it does look like a severe injury. But it's important to realize that a hyperextension is not a specific injury. It's a position of the limb that predisposes different tissues to injury, but it's more a description of how the knee is positioned. It's not actually an injury in and of itself. But if we look at our biodigital anatomy tool here, we'll point out some of the structures that are often injured with these types of injuries. The first is going to be the capsule of the knee joint. This is a synovial membrane that basically surrounds and protects, lines that knee joint. And oftentimes this is stretched. Whenever somebody has a hyperextension, remember, we're kind of looking this way if this were Giannis. And so extension again is going to be out in this direction. And so that's going to stretch and put the back portion of this capsule into tension. So it's going to pull, and you can get a posterior capsule tear as sort of a minimum with this type of an injury pattern. The other thing we think about if we get rid of the capsule is you can have a severe bone contusion or bone bruise because of how the front part of the tibia and the front part of the femur are excessively pinched together whenever that tibia hyperextends upward. So capsule injury, bone bruise are sort of the minimum kind of best case scenarios that we think of, similar to like what happened with Joel Embiid. But the big fear here that we see with these hyperextensions is underlying ligament injury to the PCL and the ACL. Often this depends on, number one, the severity in terms of degrees of hyperextension, but also if the knee went inward or outward along with that hyperextension. That PCL here is running along kind of the backside of the knee. And so if we swing this tibia forward into hyperextension, you can imagine how that's going to pull and stretch this PCL, so you can have PCL tears. But it's also going to pull and stretch on the ACL. So to be totally honest, you can have a wide variety of injuries with these knee hyperextensions that depend on a lot of small kind of specific factors with how exactly that knee was positioned. But the ACL and the PCL are always a concern when we see a hyperextension, especially one as severe as Giannis. Now, that doesn't mean it's a guarantee that he has one. He could certainly escape this with just a capsule strain and a bone bruise, but we always do have to think about the ACL and the PCL, along with, honestly, the MCL and LCL when we have these hyperextensions. So a specific injury pattern, hyperextension, that can result in a wide variety of specific injuries. If we look one more time back at the play where this happened, now I want you to visualize those knee structures. So that capsule surrounding the knee joint, whenever he lands, that capsule, particularly in the backside of the knee, is going to be stretched, causing a potential capsule injury. That front part of the tibia right here is going to compress into the front of the femur, causing a potential bone bruise or bone contusion within the knee joint. And then, of course, the possibility of an ACL or a PCL tear, depending on the severity and the force applied to those ligaments. Now, it's hard in this specific view to see exactly how much varus or valgus, meaning side-to-side movement, there was in the knee, and that's a big factor that's going to determine the risk of an ACL injury in particular. We can't really see that in any of these views, so it's hard to know how much of that was there that could play into what's going on. I feel like in this view, we can even see kind of the deformity in the joint here in the front just because of how significant this hyperextension is. So again, pretty significant looking degree of hyperextension. I would be pretty shocked if he didn't have a serious injury here. And again, even at a minimum, when we see something like a severe bone bruise, a capsule strain, that when we're talking about playoff time course can be enough to put you out for the playoffs. So really hope that he avoids something serious here. But if he does, it really is going to be just a matter of luck because this does look quite bad. And finally, there's nothing about the season schedule, about fatigue or anything that's going to play into this. Kind of like when Kyrie fell and sprained his ankle, when Trae Young stepped on a ref's foot. This is just bad luck. There's nothing about Giannis's fatigue, Giannis's conditioning, the schedule that caused this injury. This is just the bad, unfortunate side of playing sports that seems to be this year happening at such the worst times. So that's it for the video, everybody. Let me know as always any questions or comments down below. We'll give you an update here depending on what the final results are with Giannis's injury. But until next time, we'll see you later.